Hi everyone, it's Dr. Katie Thompson here with the Health Improvement Center. I wanted to discuss another nutritional pioneer. I discussed one Monday, Royal Lee. Today it is Dr. Weston A. Price. Some of you may be familiar with the Weston Price Foundation, which helps to forward Weston Price's information and get people healthy with a traditional diet. Weston Price wrote a book called Nutrition and Physical Degeneration, which is quite an extensive book that I've read about nutrition and specifically, about the traditional diets of Native people. He went around in the 30s and 40s and studied traditional cultures like the Eskimo, the Aborigine, the Gaelic, the Hebrides, the Gaelics and the Hebrides in Ireland and Scotland, and quite a few other native cultures to see what they were eating, because he was trying to determine what was causing the horrible health that he was seeing in his clients in his dental practice in Cleveland, Ohio. And what he found was these traditional cultures, when they had stuck with their traditional foods, which was mostly, guess what? Fat. Was mostly fat and whatever they could grow depending upon where they lived. And he found that they always had one specific food that was their sacred food that they gave to women just before they got pregnant, babies, mothers while they were nursing. And guess what? Again, it was fat. And interestingly enough, when these cultures started to get exposed to the traditional, or the the regular diet of the Western civilization, their teeth started to show deformities. Their jawline changed, it became more narrow, and when he saw that when folks were eating their traditional diet, their faces were very wide, they had perfect teeth, yet these people saw no dentist whatsoever. The Gaelics in the Hebrides, they actually had kind of a green moss on their teeth, as he described it, that kept their teeth healthy because they didn't have toothbrushes, they didn't have dentists right there. But as soon as these cultures were exposed to the traditional, I keep calling it a traditional diet, the Western diet, as it were, that's when their teeth started to go downhill. What I mean by a Western diet, they were exposed to jams and jellies, sugar, because sugar was being traded then, and white bread and white foods, and it was destroying these cultures. The Aborigine in Australia, for example, now have probably the highest rate of diabetes and kidney disease and kidney failure. If you watch, it's called the sugar film, and it's about, he puts himself through, the gentleman that wrote it, which I'm forgetting who it was, he puts himself on a high sugar diet and sees the effects of it, and then he goes out and looks at the Aborigine and talks with people who have been studying the Aborigine culture, and finds that when they're exposed to the horrible Western diet, the standard American, I shouldn't call it the standard American diet, but this sad diet, the horrible food in the diet became a problem, and that's what's happening to us. We're on a horrible diet of sugar, white, refined foods, thinking that it's healthy, and it's not, and it's having detrimental effects. It's creating metabolic syndromes, it's causing cancers, it's causing a host of illness. It aggravates kids and attention issues, and now you've got all these kids on heavy psychotropic drugs, which are linked to school shootings. But that's for another topic. I hope this was something that you can use and take part in and start making changes in your life. If you're interested in finding out more about Weston Price, go to the Weston Price Foundation. It's WPF.org. That's WPF.org. The website is fantastic. It has a lot of really great data. I use a lot of that traditional diet in my own foods, but also in helping clients get healthy. So again, this is Dr. Katie Thompson with the Health Improvement Center. Thanks for tuning in, and I will see you next time.